it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, James and Christine, and the question in the last week episode was how to wean off ventilation and tracheostomy step by step. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next questions regarding James and Christine's dad in ICU who suffered from hemorrhagic stroke. James and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. Their dad also underwent a craniectomy, which is a partial removal of the skull to decrease the brain pressures after the bleed. James and his sister Christine were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, their dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also at the same time had a PEG tube for feeding inserted. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could wake up and progress to neurology rehabilitation. Well, since last week's one-on-one consulting and advocacy session, James and Christine's dad has been off the ventilator and has been moved from intensive care to a step-down unit. Their dad still has the tracheostomy in place, but is off ventilation and he's breathing by himself. He is still having occasional seizures, and the doctors and the nurses are still trying to optimize the seizure medications. So in today's episode of Your Questions Answered, I want to answer the next series of questions from James and his sister Christine again, and they are excerpts from various one-on-one phone and email consulting and advocacy sessions this with me. And the topic this week is how to get into neurology rehabilitation from ICU after a stroke and avoid a nursing home. You can also read or watch previous episodes of one-on-one consulting and advocacy with James and his sister Christine by clicking on the relevant links below this video. And if you are watching this on YouTube, just click on the link below this video. That'll get you to our website where you can read the dialogue between me and James from this consulting session, and you can also access other episodes of Your Questions Answered on our website. Also look out for next week's one-on-one consulting and advocacy session where we continued the discussion between James, Christine and myself to get their dad into neurology rehab. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find international phone numbers on the top of the website, and also have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.